So my career started when I believe from a very young age being inspired by my mother, who's worked as a nurse for over 30 years now, watching her and going speaking to her colleagues from a very young age of 4 years onwards. I've been going to the trust and meeting her colleagues. I was strived into healthcare, and which then led me into choosing in health and social care in college, which then promoted me into doing understanding more about occupational therapy during my placement, during health and social care placement times. During my occupational therapy study education program, I was able to understand and learn about various patient caseloads and work in different sectors, including ranging from anywhere between complex discharge teams to mental health teams for schizophrenic people, schizophrenic individuals, social prescribing, and as my CV suggests, I was able to work in neuro rehab as well. After graduation, I was able to work in gastroenterology team and the cardiac team and in the stroke rehab team. All these three were my band five rotational was done in the same hospital that my mum worked in. I was able to give something back into the community, which I feel very proud about. And during this placement and during these rotations, I was able to learn a lot, and my my senior management, including my band 7 and band 8, was able to promote me into a specialist role at the moment, which is the specialist stroke rehabilitation occupational therapist. During this time, they were very proud about my clinical leadership and management skills, especially at one point where a patient and their family was not being ready to be discharged. They were very adamant that they would not be discharged as they had various concerns, um, regarding, and they thought that they had to be in hospital for a longer duration. However, the patient was medically fit for discharge and therapy fit for discharge. At this opportunity, my band 6 physiotherapist at that time had spoke to the family about delays on discharge and promoted an early discharge. However, they were not happy with this. At that point, when I went in and I had a conversation, introduced myself and role, was able to create a rapport and empathize with them what was going on. And at that time, they felt more confident. Sorry, they felt more confident and competent about my skills, and I was able to facilitate a safe discharge by promoting and planning, and referring to other teams. In one word, I believe my experience as occupational therapist is rewarding. There is no other word that I could say for it. It has been a journey of 3 years where I have worked with individuals, as I mentioned, in the gastroenterology unit, the cardiac unit, and the stroke rehabilitation unit. The stroke rehabilitation unit is where I have been specialized in and been working and providing specialist care for individuals who's had a stroke. I've been able to provide training to both patients, families, and my employees, including band five occupational therapists and the therapy assistants that work in my team. In terms of what client populations I support with this day and age of with stroke and specializing in stroke, we have seen individuals who've had stroke for from age of 27 to an individual who we had recently of 96-year-old, and each of their needs are very personalized, and I think that is the element that is what makes me as an occupational therapist very rewarded about it. It is we personalize each therapy, so which we personalize each therapy intervention we provide to them. In terms of specializing in neurorehabilitation, that is the area that I am working with, and I think one incident that has kept me in loop is when a stroke patient who had right packs came in, and he had no sitting balance, was very, communication was very struggling, had low mood, low motivation, and I was able to create a rapport with this individual and make him use mindfulness techniques and motivational techniques, apply the theory of Mohost into practice, and from there, alongside his physical, as well as his physical abilities improving, I was able to see that improvement in his mood and motivation, which then when he left the ward, he went as a stand-aid. I was able to provide safe equipment provision, provide package of care, referred to community therapists. He had left the ward, I believe, as very minimal assistance of two and stand-aid. And last year when we did a summer fair, he came back and walking into the ward and thanked me for all the input that I have made, and even nominated me for one of the Great Excel Awards, which I think was so rewarding for me. When talking about pediatrics, I have worked with children and individuals with learning disabilities, though not as an occupational therapist. I've worked with them whilst I was working in this as a support worker, and whilst I was in uni as well. As someone who's had family living in Australia for over 50 years, I've had opportunity to discuss with friends and family about the Australian healthcare system. And whilst we have discussions about NHS, the similarities, the differences, and one thing that I realized is how much health healthcare professionals and the managers, the healthcare system promotes and prides in the infrastructure and continuous professional development. As someone who believes that we learn something new every day, it's that really rings a bell with me. I think that working in Australia in terms of learning and professional development has helped my family members into getting into higher positions, as well as providing the healthcare back into patients and back into the community. When we are up to date with our practices, the professional growth, the learning, the knowledge, I believe this not only helps the individual itself, so not just myself, it'll help my personal growth, it'll help my professional, and also back into the community as well, because we're providing evidence-based care. From what I've researched about the Australian healthcare system, is that the infrastructure is closely like it's enrooted with continuous professional development, research practice, and this thirst for knowledge. And I think that is something really great. Um, and yeah, that's one of the reasons that I would like to come to Australia.